Level 1. Mortuary Assistant. You just got accepted into a mortuary science program. Your family asked you twice if you were sure about this career choice. You said yes both times. What you didn't tell them is that you're not entirely sure yourself yet. Your first day in the anatomy lab, the smell of formaldehyde hits you before you even walk through the door. Your hands are sweating. Everyone around you looks just as nervous, even though nobody wants to admit it. The coursework is intense. Anatomy, physiology, embalming chemistry, pathology basics, and grief counseling. You spend more hours studying than you ever did in any other class. This profession demands precision because there is no room for a second attempt. Your supervisor walks you through your first hands-on observation. You're not doing anything yet, just watching, learning the careful, respectful process of preparing someone for their final goodbye. He tells you something you'll never forget. Every person on this table was someone's whole world. You sit in on your first family meeting. You watch how the staff speaks to a grieving widow, gently, patiently, with complete attention. This job isn't just about the technical work. It's about being present for people during the worst day of their lives. Some nights you walk home and think about everything you learned that day. It's a strange thing to study death so closely while you're young, and everything in your own life still feels far from finished. You start to see life differently. Most people in this field do. You practice restorative art on training models for weeks before you're allowed near an actual case. Color matching, texture work, careful, precise technique. The goal is always the same: to give families a peaceful image to remember, not a clinical one. Your first real case. You're not performing the procedure. You're assisting, handing instruments, taking notes. Your hands are steady, but your mind is racing. This is no longer a textbook. This is someone who had a name, a family, a life that ended. After your first real case, you sit outside for a long time before going home. Nobody warned you how much this would weigh on you emotionally. You realize quickly that this job requires a kind of quiet strength that isn't taught in any textbook. You have to find it yourself. Graduation day. You're officially certified. Your family still doesn't fully understand why you chose this path, but you do. Somewhere between the formaldehyde and the formal training and that first quiet case, you found purpose in being the person who treats the end of life with the same care most people only give to its beginning. Level 2. Licensed Mortician. You passed your state board exam. You're now legally certified to do this work on your own. The certificate in your hands feels heavier than paper should feel. It represents years of study and your first real responsibility over another person's final care. Your first day working independently. No supervisor standing beside you this time. Just you, your training, and a quiet room. The weight of doing this alone for the first time settles in slowly. You take a breath, put on your gloves, and begin. You sit with a grieving family by yourself for the first time. They ask questions about the process. Some cry, some are eerily calm. You learn quickly that grief has no single shape, and your job is to meet each person exactly where they are, without judgment. Helping a family choose a casket sounds simple until you're standing in the room watching someone make a decision they never wanted to make. You learn to be patient, to answer the same question 3 different ways if that's what someone needs to feel okay about their choice. Some cases require hours of restorative work. A difficult case from an accident. You work late into the night, alone, focused entirely on giving a family something peaceful to remember instead of something tragic. Nobody sees this part of the job, but it matters more than almost anything else you do. You attend the services you prepare for, standing quietly in the back, making sure everything runs smoothly. You watch people say goodbye to someone you spend hours caring for in private. It's strange and meaningful at the same time, being part of someone's final chapter while staying completely invisible to it. The phone calls come at all hours. Deaths don't follow business hours, and neither does this job. You learn to answer at 3 a.m. with the same steady, calm voice you use at 3 p.m. Families remember how you sounded in that first phone call for the rest of their lives. Some weeks are harder than others. A case involving a young person, a family that couldn't stop crying. You come home and sit in silence for a while before you can talk to anyone. This job asks you to absorb other people's worst days over and over and still show up steady for the next family the next morning. A family sends you a thank you card weeks later. They write that the way you cared for their father gave them peace during the hardest time of their lives. You keep the card. You don't get many moments of recognition in this job. The ones you do get, you hold on to carefully. A year into this work, you look in the mirror and see someone steadier than the nervous trainee who walked into that anatomy lab. You've learned to carry grief without being crushed by it, to find meaning in service most people would rather not think about. The work changes you, quietly, permanently, and mostly for the better. Level 3, Autopsy Technician. You're moving into a new part of this field, working alongside forensic pathologists in a hospital morgue. This isn't about preparing someone for a funeral anymore. This is about helping uncover exactly how and why someone died. Your first walkthrough of the autopsy suite. Everything is stainless steel, precise, and clinical. The pathologist explains the equipment, the protocols, the documentation requirements. You realize quickly that this job demands a different kind of focus, part medical, part investigative. Most of your early work is preparation, organizing instruments, labeling evidence containers, maintaining a chain of custody for every sample. It sounds administrative, but a single mislabeled container can compromise an entire investigation. Precision here isn't optional. You assist during your first real autopsy. The pathologist talks through every step, explaining what he's looking for and why. You hand him instruments, document his observations, and try to absorb everything at once. This is medicine, investigation, and respect for the deceased, all happening simultaneously. You learn the science behind the work. Tissue samples, toxicology screenings, microscopic analysis. Every detail collected here could become a piece of evidence in a courtroom months later. You start to understand that this job sits at the exact intersection of medicine and justice. The paperwork is constant and exact. Every observation has to be documented in language precise enough to hold up in court. You spend almost as much time writing reports as you do in the autopsy suite. A pathologist's findings are only as strong as the documentation behind them. A detective comes by to discuss a case you worked on. It's the first time you realize how directly your work connects to ongoing investigations. The findings from your autopsy suite could determine whether a case is classified as an accident, a suicide, or something else entirely. Some days are heavier than others. A case involving a child. A case with unclear circumstances that haunts you a little. You take your lunch breaks in silence more often than you expected to. This job requires you to build an emotional discipline that nobody can teach you in a classroom. After months of training, the pathologist starts trusting you with more independent responsibility. You prepare cases almost entirely on your own now, with him reviewing your work rather than guiding every step. The nervousness from your first day has slowly turned into quiet competence. You found your footing in this part of the field. The science fascinates you. The investigative side keeps your mind sharp. And somewhere in the middle of all the precision and procedure, you found a strange kind of purpose, helping uncover the truth for people who can no longer speak for themselves. Level 4, Forensic Pathologist, Medical School Residency, a specialized fellowship in forensic pathology, years of additional training beyond everything you've already done. You are now a licensed physician whose entire practice is dedicated to understanding death. Your first day with your own office and your own caseload. The name on the door is yours now. The technician who once trained you is now someone you work alongside as a colleague. The shift in dynamic feels strange for the first few weeks. You perform your first autopsy as the lead physician. Every decision is yours now. Every conclusion carries your signature. You move slower than you will in a few years, double-checking everything because you understand the weight of what you're about to officially declare. Your first ambiguous case arrives, a death that doesn't immediately explain itself. You spend hours cross-referencing police reports, medical history, and toxicology results. The pressure to get this right isn't abstract anymore. A family is waiting for an answer, and possibly so is a criminal investigation. You're called to testify in court for the first time. Your medical findings are now part of a criminal trial. You stand outside the courtroom for a moment, reviewing your notes one final time, fully aware that a defense attorney is about to question every detail of your professional judgment. You explain complex medical findings in language a jury without medical training can understand. This skill takes years to develop. The truth only matters if you can communicate it clearly to 12 people who are deciding someone's fate based partly on your words. Some cases stay with you longer than others. A case involving a child arrives on your table, and no amount of professional training fully prepares you for that. You work late that night, not because the case is medically complex, but because you need the quiet time alone to process it properly before going home to your own family. You're asked to present your findings to a homicide task force for the first time. Detectives who have worked dozens of cases listen carefully to your medical interpretation. The room takes your conclusions seriously, and you realize how much influence your professional opinion now carries in shaping an investigation's direction. A detective calls to tell you that your findings were the key piece of evidence that closed a case. You hang up the phone and sit there for a moment. This is the part of the job that makes everything else worth it. Knowing that your careful, exact work gave someone's family the truth they deserved. A year into the role, you understand the full weight of what this job actually is. You are the last advocate for people who can no longer speak. Every conclusion you write becomes someone's official answer, someone's path to justice, someone's chance to finally understand what happened. That responsibility never gets lighter, but you've learned to carry it well. Level 5, Chief Medical Examiner, the highest position in this field. You now oversee an entire office, dozens of pathologists, technicians, and investigators, all handling thousands of cases a year across an entire city or county. Your mornings now involve briefings with city officials, police commissioners, and sometimes the mayor's office. Your office's findings shape public health policy, criminal justice outcomes, and sometimes entire legislative decisions. The cases on your desk are no longer just medical files. They're matters of public trust. A high-profile case puts your office in front of news cameras. You choose every word carefully, knowing that an entire city is listening for answers. The pressure of public scrutiny is something no amount of medical training prepares you for, but you've learned to speak the truth clearly and responsibly. Mentoring is now a core part of your role. You sit with junior pathologists exactly the way someone once sat with you, patiently, honestly, preparing them for the weight of this profession before they have to carry it alone. You see pieces of your younger self in every one of them. A pattern emerges across several unrelated cases, something your office identifies before anyone else does. Your findings lead directly to a citywide public health intervention. This is the part of the job most people never see. Forensic pathology isn't just about individual cases. It's about protecting the living by understanding the dead. After decades in this field, you understand something most people never have to confront directly. Every case that crosses your desk is a reminder of how fragile life actually is. It hasn't made you fearful, it's made you grateful, present, and deeply aware of how much it matters to live fully while you can. You return to lecture at the same university where you once sat nervously as a student. You tell the new generation the truth about this career, that it will ask everything of you emotionally and give you something in return that few other professions can. The chance to be the last voice of truth for people who can no longer speak for themselves. Standing at your office window at the end of another long career, you think back to the nervous trainee who first walked into that anatomy lab, terrified of the smell of formaldehyde and unsure if he belonged there. Every rank, every case, every difficult night taught you the same lesson over and over, that caring for the dead, in the end, was always about honoring the living, and that is a purpose worth dedicating an entire career to.